Thanks to everybody who's joining us. I just want to thank you all for being here and let you know we'll get started in just a couple minutes. We'll give people a minute or two to get logged in and settled. Right. Welcome, everyone. Thank you for joining us for our Community Engagement Forum. I'm Sarah Brewer. I direct the education program at Accords, and we host this forum in partnership with the CCTSI Community Engagement and Health Equity Core. I'll get us started with just a couple of announcements about upcoming events and opportunities for folks. So first, if you've missed any of our former community engagement forums, you can watch those on the CCTSI website and on our Accords education page. What do we have? An announcement, the Colorado Immersion Training Program is accepting applications. Those are due on March 1st, and you can get some more information there on the CCTSI Community Engagement Core website. Accords, a little bit for those of you who don't know about us, is a one-stop shop for pragmatic research, and we provide all kinds of supports for those of you who are researchers, including support for your community partnerships. We have a few upcoming events where we have a shared decision-making seminar series and a statistical methods series, and you can see our upcoming events in February and March here. The Colorado Pragmatic Research and Health Conference registration is now open, and that'll be held virtually on June 5th and 6th this year. You can get some more information there, again, on the Accords website. And then we're excited to announce that our next community engagement forum, we are planning to host in person on campus with both our researcher and community partners. And we hope that you'll all mark this on your calendar for April 26th and plan to join us from 11 to 1 in the Anschutz Health Sciences building. Right. Today, we are talking about building capacity for community and academic partners. And we're going to dig into specifically the Colorado CEAL example, which is a project here sponsored by NIH and NHLBI to focus on engaging communities to address disparities in health. And I'm going to let them tell you a lot more about it. But before we get started, I wanted to spend just a couple of minutes getting us all a little bit of level setting around what does capacity building even mean? What does that look like before we dive into some specific examples? So let me share a couple of slides. So I'm just going to talk about capacity building. I'm going to put a particular lens on capacity building for community research partners. But before I dive in too much, I'm going to say that this is a two-way street. I just happen to be sharing from a couple of projects where the focus was helping to build capacity for our community partners. So I'm going to share two figures, but this first figure is one model that we used to think about the skills and capacity that our community partners needed to build to work in partnership on research. And so this we actually built with the members of our Refugee Review Board, which is a part of the Society of Refugee Healthcare Providers. And they helped tell us what they needed to build their capacity. And we started to put that into buckets and think about, okay, where do we start? And this is the model that we came up with. And we thought about these in buckets. So the first being this foundational level, then building on that with some more specific content and knowledge, and then building the skills, the how to do this. So let me walk through those for folks. The idea of the foundational is what are the things you need to do to even get started? You need some basic knowledge. What is research? What are we partnering on? What are the things we're going to work on together? So this foundational piece is really some common understanding that partners need to come to the table together. And some of the things they put in this bucket were, what is research? What are research ethics and human subjects rules? What is the value of community partners? Can we get on the same page about what the value of having community partners is? What are some of the models for partnership? How do we think we want to engage? And what are our expectations? How do we want to engage with each other moving forward? Once some of that common foundation was built, the next piece was building knowledge. What's our project? What's our basic research design? What's the content? So that could be disease information, that could be health and communication information, but digging a little bit more into what are the things we need to know for this work together. And once we've all got that shared knowledge, moving into skills, thinking about what are the things we all need to be able to do, whether that's writing. These are examples of some of the skills that they put here. Thinking about writing skills, thinking about facilitation, thinking about data collection or analysis skills that people needed to be able to engage in. One of the things this group particularly added was trauma-informed approaches. What are some of the skills we need to ensure that we're not triggering anyone's trauma, that we're not reinforcing trauma, that we're really working in a way that creates an inclusive, safe space for all of our partners. And then I wanted to share one other example because the first model does this in sort of a linear way. We build on one level before we move to the next. This example is a little more iterative. So we have some of the same things. We've got some foundational topics, some knowledge topics, some skills topics, but also this idea of building leadership. So things around community advocacy, public speaking, meeting facilitation. And this project did this more in an iterative way, moved from topic to topic as the group needed, as partners identified the need. And I wanted to point out that this particular group used a tell, show, do model. So when there were new skills, we talked about them, then we demonstrated them, and then we tried them together. So one way to think about capacity building. And then before we move to our panel, I wanted to share just this idea that capacity building is part of your research partnership. And so this doesn't exist separate from the other work that you're doing together, but it helps the group and the partners do this work better to continue to grow together. So similar principles to all the other parts of your research partnership. Think about the timing of your meetings and your capacity building activities. Think about, can you provide childcare so that everyone has the opportunity to build their capacity and their skills? Compensating and paying for capacity building, just like you do your other research activities. And then again, circling back to this, the engaging in this principle of co-learning. How are your community partners and your researchers growing their capacities, learning from each other throughout your work? So how do you build capacity building as a two-way street and think about what people are learning from each other along the way? With that, I am really thrilled to introduce our panelists today. So first, we have Sol Sandoval. She's a first-generation daughter of immigrants from Colima and Mexico. Sol is a fully bilingual Latina from a union family and a seasoned community leader who's been fighting for working people for over 20 years. She's a Chicana community organizer and former candidate for U.S. Congress in the 3rd Congressional District of Colorado. Second, we have Javier Garcia Arellano. He has a background in community work from serving families in Aurora as a family support services health coverage guide and family advocate since 2015. For the last 2 years, Javier's worked for 2040 Partners for Health as a community research liaison. Welcome, Javier. Oh, sorry, guys. Next, we have Lisa Lucero, who's Director of Implementation at the San Luis Valley Area Health Education Center. And during her extensive 25-year plus at SLV AHEC, she's implemented groundbreaking projects serving the local San Luis Valley community, and she adds her perspective and expertise to various boards around the state. And finally, we have Don Neese, who is Director of Community Engagement and Health Equity within the CCTSI, and serves as one of the principal investigators for the CO-CEAL project. And now I'd like to hand over moderation to Chelsea Bigudi. She's a member of the Navajo Nation, has been resident in Southwest Colorado for 4 years, and her work is primarily in public health education and nonprofit at a nonprofit organization called the Southwestern Colorado AHEC. And Chelsea's going to moderate our panel for the rest of today's session. Thank you, Chelsea, if you want to take the floor.
All right, awesome. Thank you, Sarah. Welcome, everybody. So excited to be in this space with such wonderful panelists, speakers, and thank you for those warm introductions as well. So let's just go ahead and dive right into it. So if all the panelists could share who you are within the CO-CEAL work and where you're located. And let's see, let's kick it off with Sol.
Buenas tardes, good afternoon. I am Sol Sandoval, she, her, ella pronouns, and I'm based out of Pueblo, and I am a community connector.
Javier Garcia. I currently work in Aurora for the CO-CEAL project. I work as a community connector and also as a data collector, and I'm in Aurora, Colorado.
I'm Lisa Lucero. I'm based out of the San Luis Valley, specifically Alamosa, and I am a community connector for the CO-CEAL project.
I'll unmute myself. I'm Don Neese, and I'm the PI for the project, one of 2 actually, along with Dr. Ricardo Gonzalez Fisher, and I'm a professor in the Department of Family Medicine and based here on the Aurora Anschutz campus.
Thank you for that. Sol, can we talk with you a little bit about some of the work you've done with communication in the work that you do?
Yeah, so some of the things that I want to share today, is that we're very intentional about the way that we communicate with, our community. Some of the things that I have noticed is that, frequently, if you're not getting the engagement that you want via email, you need to reach out via text. And it's just a matter of asking people, how do you prefer we communicate with you? What is easier? But I have personally found that communication using text message usually gets quicker results and more engagement. It's a little bit warmer. It's a little bit more intimate than an email. So that's something that I've noticed and I prefer. Other things that I always keep in mind is that depending on who you're working with, you just have to be really intentional that you're not making people feel uncomfortable. So I'll give you an example.
Oops, sorry, Sol. It looks like you're glitching in and out right now. You were just about to hop into that example.
Okay, sorry about that. Yeah, so an example would be, let's just say that I need individuals to sign in or RSVP. We're not going to ask for more information than is necessary. I frequently avoid even asking, say, for an address. I will keep it very simple, just first name, phone number. And later down the road, once we've established, a relationship, if they want or if we need to gather more information, we do that. And we also ensure them that it's not going to be shared. So always making sure that they know what we're going to do with the information that we gather. It's very important to continue that trusting relationship, and so that there's no room for, wondering what we're going to do with the information that we've collected. Something else that I would like to share is that a lot of times we will request individuals to RSVP, and then we'll assume that because people didn't RSVP, they're not going to show up. And I just think it's a cultural thing sometimes. Some people just don't like to RSVP. And I think it has to do with, if I RSVP, it's written in stone, I have to go, and I'd rather just pop in. So just giving individuals that option of, if you would like to RSVP, go ahead and RSVP. If not, here's the link, you can still join us. I just think that flexibility means a lot. And this is one of my favorites, avoiding internal jargon. Oh my goodness. So we get so excited and we are talking real fast. We feel comfortable in the work that we do. And so we assume that everyone knows and understands our internal jargon. So some of the things that I like to practice and encourage others to do is even like having just a sheet. In the event that it might get out, you might use that internal jargon, or maybe you have to. Maybe there's some definitions that individuals that are not necessarily experts in that field, they wouldn't be familiar with. Give that to them. Don't have people sitting around wondering what you're talking about. Just giving it to them, and even providing, something like a link, or here's a number if you have more questions. Here's my email if you want to talk to me about something that you'd like more clarity around. Just being really upfront. And also not using a lot of fancy words that some individuals may not be able to understand or be familiar with. I just think it's respectful to make sure that, everyone in the room is comfortable and understands. Let's see. Always providing an environment where people feel safe. I can tell you that the team that I work with now, I feel extremely safe. If something doesn't feel right, if there's something that I feel that perhaps we could improve, I feel safe and comfortable sharing that with everyone that's here today on this panel. It's so important for people to feel heard and understood, and that someone's going to listen when they provide that feedback. Because if they don't feel like it's going to matter, they're not going to offer it. So always make sure that people feel safe. And some of us enjoy talking and some of us don't. So I always find that allowing people to anonymously submit feedback, comments, or if it's in person, you could even go as far as like just handing out little cards and asking people, hey, if there's a question that you want to ask and maybe you don't want your name tied to it, or if there's a comment that you want to give us that, maybe they feel bad sharing out loud because maybe they're just shy. It's so important to give people more than one way to communicate, more than one way to ask questions and share. But I'm telling you that I'm super excited to be working with CO-CEAL. I've been working with CO-CEAL for quite some time now, and I know that our community respects them, they feel safe, and they can count on having me as an advocate who is going to bring back, whatever honest information, whatever feedback we're getting. And that's why I feel this work continues to move forward and, so smoothly. And we've been so successful because we work together, we listen, and we support each other.
Thank you for that, Sol. Thank you.
One more thing.
That-
Am I at time
oh.
by chance?
Yeah, you do have time. Go for it.
Perfect. So one thing that I almost forgot was simultaneous interpretation. Oh my goodness. Okay, so a lot of times organizations will provide simultaneous interpretation, and it's almost like a fancy lamp that's in the corner just to say we have it. And a lot of intention doesn't go behind actually prepping people in the room for everyone, before we start, make sure that your equipment works, make sure that it's charged, make sure that you're on the right station. Also, if you're going to provide interpretation and you do have the capacity, maybe someone on staff speaks Spanish, it is extremely kind to split some of the time in Spanish so that individuals don't have their headphones 6, 7, 8 hours, however long the training is, because it is really difficult. And so not only is language justice having it available if someone needs it, but it is being prepared for if someone does want to speak. It doesn't take us 5, 7 minutes just to figure out how do we get people connected. So it's making sure that if we have people on staff who are bilingual, they have the opportunity to present in Spanish, because I have always noticed that if I'm in a room with English and Spanish speakers, it's not until that first person speaks in Spanish that everyone's just going to kind of stay quiet. It's kind of like when you're at a wedding and it's like someone has to go out first and do the first dance for everyone else to feel, safe and comfortable doing it. The first person to get the plate, makes it easier for the second, that sort of thing. So if you are going to provide interpretation, why not have someone present some content in Spanish, have someone that's ready to ask some questions in Spanish, just to kind of, even out the environment and making sure that one language is not 100% taking over the other, because it's a natural thing. English will always take over if we're not intentional.
Thank you, Sol. Appreciate that. Along with the conversation you had about teamwork, that's a good segue to Lisa to talk a little bit about her community, being a community connector and a person who has a role at a high level in the work that she does. So Lisa, could you share a little bit more on how, capacity building, how you capacity build in your organization or your work?
Sure. So I served as the community connector for the San Luis Valley, and I didn't even know that there was a name for the things that I did within my community as a gatekeeper and connecting people to resources and such. So I was really kind of the boots on the ground for CO-CEAL in my area. And I worked hand in hand to what I think is the secret to the whole sauce of CO-CEAL and data collection, and that's working within community engagement lead, Charlene Barrientos Ortiz. She led the community connectors, and then she was liaison between the community and the university. And, after doing 25 years plus outreach in my community, I thought I knew everything, and I did know a lot, but I also learned a lot with the relationship with the community engagement lead. We co-created processes together. No matter how much I was disinterested in check marking who's bringing the markers or who has the right information on, invoices and such, we created processes together to address those. Most importantly, she taught me to use my intellect over emotion to change things. Sometimes I could be a little bit rogue. So when I was charged with helping out with a new research project associated with CO-CEAL, I knew the right questions to ask. I knew I had a voice. I knew that I could ask for my data collectors to receive city train as part of their training in data collection. I knew that I could ask the lead or tell the lead PI that it doesn't feel good to ask my people demographic questions at the end of the survey. Can we move them to the front? And he did. And he also did provide the city training. So now in the San Luis Valley, we have 6 data collectors who have city training, who will have the upper hand when other research projects come along in the San Luis Valley. And another kind of example of creating capacity, in the fall of 2023, the CO-CEAL team provided a facilitation principles training in the San Luis Valley. And it was just kind of an overview of meeting facilitation. And I was charged with finding folks to be a part. So I found folks with varied experience in facilitation from all over my region. So it wasn't just Alamosa, which is oftentimes when things happen in the San Luis Valley, it's very Alamosa centric. And when I was preparing for this meeting, I wanted to tell you a story about a gentleman who took part in the facilitation training. Very, very shy. When he was on Zooms, he wouldn't speak up. He'd look down. After the facilitation training, it increased his confidence. So the story I was going to tell you today, that even though the focus of the training was facilitation, something greater happened that day in building capacity within the San Luis Valley. But my story changed about a week ago. His organization's working in collaboration with my organization and a third outside facilitator to address Latinos in the outdoors. And we're going to have a community engagement meeting next week. And initially, he was going to take notes for one of the sessions. And I spoke up and I said, well, he has some facilitation training. Like, how about we let him lead? And he was excited to do it. So now he's actually going to lead a breakout session. So I think that's pretty great.
That's great, Lisa. Just to backtrack a little bit, I'm so sorry, but could you explain a little bit more about what a community connector is?
Sure. So community connector, I was charged with finding the data collectors in our region. I was the connection between the community engagement lead and the data collectors. I was in charge of we'll hear a little bit later on about BCT, but I was in charge of finding the folks to take part in BCT, and to just kind of guide them a bit and kind of be, even though it wasn't my role, kind of just be like the connection between the facilitators of BCT and the folks who were in the cohort. Sometimes it was hard for them to share with facilitators what they could share with me. So it aided in the communication with the facilitators and the cohort.
That's great. Yeah, a lot of trusting factors, right? In the building, strengthening those components of capacity building. And so now that you talked about BCT, we're going to go ahead and move it on to Javier. Javier, could you talk a little bit about, your role as well in this, touching on those points of capacity building and as a facilitator, BCC facilitator, and community surveying?
Yeah. So I came into the project of CO-CEAL as a community connector, and then later I became a data collector. So when working in community, we have to recognize that building capacity within is extremely important, and representation is everything. So for example, I've noticed that when we go into trainings, that there are people that look like us, that represent some of our values, that speak our language, as Sol was mentioning earlier. I think it's extremely important to recognize who you're going to be working with. Often we are grouped into one group of Latinos, or some of the stuff that sometimes is created, it's created for just one specific group. But I think it's extremely important to recognize that as Latinos, we're very complex and we come from different backgrounds and different, we're of different colors. And we want to see that representation when we go into space, especially when someone's facilitating that does not look like us. I think by doing that, there's already a barrier when coming into those spaces. So when I was offered the opportunity to come to the BCT facilitation training, I thought it was extremely important because we often hear it, that it is important to build within the community, but having so once they gave me that opportunity, I was really impressed of how the facilitation training is run, and I was very happy that I was a part of it. Often when we go into, let's say, data collection projects, we are collecting data. I work mostly with Latinos that speak Spanish, but also English, but the majority are the Spanish-speaking Latinos that I work with. I can see that they trust that I'm going to protect their information. When we go into data collection, there's a lot that we say that we're going to protect. We read a whole script that says that we are giving them security, that the information that they're going to be sharing with us is important, is going to be protected. But I think I think mainly they trust that we'll do that because we have worked in the past with them, or because we look like them, because we sound like them. So I always say this, and I think it's just so important that when building capacity, we recognize that representation within our own community is so important. So hiring within the community is important. Recently, I was working on a project where we were collecting data that is very, very sensitive. And somebody that's working with the project told me that they were having a really difficult time collecting data because it's very sensitive data. So I thought, so one of the things that I mentioned to her was, I asked her who was collecting some of the data, and she said, well, some of the people in the project. But once she gave me the names, I off the back knew that they were not people that looked like the people that were going to be collecting data from. So she gave me, so I went into my community and I started asking for data, and as Sol was mentioning, making the phone call, sending the email. Sometimes you have to do these things in person. You have to go to a space that they feel safe and say, hey, I'm here. This is one of the projects that I'm working with, and I know we're going to be collecting very sensitive information, but I can assure you that we're going to do everything that we can to protect everything that you're going to be sharing with us. And it wasn't really that challenging, honestly. Once I was going into these spaces that we have created that are safe spaces, people were willing to give me their information. So I called back the person that I'm working on this project with, and I said, look, I don't think that it was the script. I don't even think they even care who I was going to be collecting the data for. I think what they took more into account was that I've worked with them over the last 15 years. These are a community that I work with for a very long time, and they really trust that everything that I've done has always been of their best interest. So it took me, honestly, 5 minutes to collect some of the data that was so hard for these other people that were trying to collect from the community that I was working with. So trust is everything. When we go into spaces, when we're trying to build, we have to understand that it takes time, that we have to go in with an open heart to try to speak honest with the people that we're going to be collecting data from, not promising anything that we cannot do. And we have to go in sometimes amending some relationships that at some point in the past have been damaged. Once you do some of those things, when doing data collection, I think that you're going to be very successful. Otherwise, I think you're going to be running into issues. So that was kind of my role as a community connector and data collector for the CO-CEAL project.
Yeah, very important piece to a lot of research. I know there's some overlap in my community on Navajo Nation that just, the research is it's been historically a sticky topic, right? And who's coming into the community to do research on our community. So building that trust with the people is very, very important. And yeah, everyone, just a reminder, please use the chat to ask any questions for the panelists that we will get to after we're done speaking here. So Dawn, we're going to hand it over to you to get some perspective as a PA.
Yeah, thanks, Chelsea. I might just start off by giving a little bit more information about CO-CEAL and what it is. And so it's a NIH-funded project. We're one of 21 teams around the country that were initially funded starting back in 2020, 2021, to address health disparities related to the COVID pandemic. We made a decision kind of from the get-go that we were going to go as deeply as possible in terms of our community engagement. And so in contrast to, what we sometimes do and what folks very reasonably often do, we didn't work through community-based organizations, but we wanted to work directly through community members. So Saul and Lisa and Javier and our other community connectors, we're contracting with them individually in the roles that they're playing. And that was part of our sort of philosophy of not only going deep, but also in terms of capacity building. And I think of these folks as really sort of our community study coordinators. They have a lot of responsibility, and they've just done an amazing job. So with that being said, I'll say a little bit about kind of the capacity building that I've felt within myself as a PI, because that's also been a journey here. I think that for those of you that are investigators, lead studies, you know that there's a lot of responsibility on your shoulders. You feel a lot of responsibility to funders. And I think with this work, what I've learned is, you have to balance the responsibility to the funder with the responsibility to the communities that you're working in. And so what that's meant for me is there have been times when I've gone to our funder and said either individually to people at NIH or in large meetings where all the PIs are present, hey, what you're asking us to do doesn't really work. It's not going to work for our communities. We need to come up with a different way of doing things. And fortunately, in I would say the vast majority of cases, our funders have listened. And so it's recognizing that Saul and Lisa and Javier may not be in those spaces, and in those meetings, I have to bring their voice to that place, and that's can sometimes be uncomfortable, and but I think it's been really, really important and paid off. The other thing I would say is that one of the things that's been really, really gratifying and is I've learned to trust all of these folks, just to feel like, I know they have my back. I know they have the project's goals, that they hold those. And when they bring us feedback, when they bring me feedback, it's with the intent of making sure that we're successful. And that's super, super important. And, that's that kind of trust takes time. And, I think I've tried to make sure that when those concerns, when changes that need to be made, when that stuff comes up, that it's not just listening, but it's also acting on those and making sure that we're making the changes that need to be made to respect what's going to work and what's going to be most beneficial in our partner communities. So those are really important pieces of this kind of work.
Great. Thank you, Don. Yeah, creating space for more voices to be heard, right? It's very important to bring more voices to the table. All right, thank you. Let's see. So we have some time, a lot of time for questions. Let's just take a look into the chat of what some of those questions are. So we have one from Leslie who said, these are very helpful tips and ideas. Thank you. How have you collected feedback and insights from the community connectors and data collectors about their role, their feelings of being valued, their sense of capacity they have gained, etc. Their concerns. If you have a survey, do you have examples to share? Thank you. Does anybody want to take this on?
Well, maybe I can start. And Leslie, thanks for that question. I will say that we've probably not been as intentional about, systematically gathering that kind of stuff, those feedback, and in a rich and qualitative way. But I do think, I'd invite folks on the panel today to share anything additional that they'd like to share about that. It's a great idea, and I think if we can figure out a way to build that into our next round of work, I'd really like to do that. We have done some work just in terms of, evaluation of our individual pieces of the project, but evaluating these roles and how they've grown, that would be awesome.
I would just say, Dr. Neese, that we've done a really good job of sharing any information that we're hearing from the community. When we are, meeting regularly, when we're debriefing, those are all opportunities for us to kind of share how individuals are responding, how long it's taking to take the surveys, what questions maybe, should be reworded, things like that. So I would say that we definitely do share. And even like at the very beginning, we'll review a survey and say, I know this already says this information is protected, but can we make it just a little bit more clear, just to be sure that there's no gap in the message. And so they are very intentional about listening to us and making any changes along the way if we're able to.
So I can share a story about capacity building. I love to share stories. When I was working with the group that received the city training, I was very intentional about who I selected, and some of them had different levels. Some of them barely knew how to turn on a computer, and others, have a master's degree and have done this work before. But when they did the city training, some of them took 2 hours to do it, some of them took 6 hours to do it, and that kind of also let me know that I maybe had to guide the people who took 6 hours a little bit more than others. So with this particular data collector, initially I had to get on Zoom and teach her how to attach invoices, to an email. And by the last invoice, we didn't have to get on Zoom. Like, it did create capacity within her. So like, no, we didn't do surveys, but like as a community connector, I saw it with my own eyes. I saw my folks grow.
Does anybody else want to share a story about their successes or challenges in capacity building?
Yeah, I'll share a story of some of the challenges that I've seen when trying to build within community. So a lot of the trainings are unfortunately in English, and I know that a lot of the community workers, promotores de salud, well, the ones that I work with mostly are Spanish-speaking promotoras and promotores. So I often see that as a challenge. Recently, we're working on a project where we're going to be choosing an agency that's going to be doing a promotora training in Spanish, but one of the challenges that I see coming is that the promotores that we're training are going to be working mainly in Spanish. And again, Latinos come from different areas of Colorado, and some don't speak Spanish. So I feel like there's definitely a challenge when it comes to the also payments. Some of these promotores obviously want to get paid, but due to their lawful status, they cannot get paid as a regular person within Social Security would. So I definitely see that as a challenge, but that does not stop promoters. They still continue to come and want to get trained, and want to go back into the community and disseminate some of the information that they're learning through the trainings, but in Spanish, unfortunately. So that's a challenge that I see.
Thank you, Javier, for sharing that. Sol, do you want to talk about some of those? No. All right. Well, we do have a question in the chat, and Dawn, this one's geared towards you. In your experience with working nationally with other sites, what differences do you see with Colorado and other states, such as those in the Northeast area, for one? Personally, I see Colorado as having several different distinct demographic cultures that you must be sensitive to. Differences among regions in Colorado, to be clear. This is from Stanley.
Yeah, Stan, thanks for that question. Yeah, I would say that there's such a spectrum in amongst the various SEAL teams. There are teams, you know, I can just think of a couple of examples. The Michigan team, the Missouri team, where they're very focused around a particular metro area. So whether that be Detroit metro area or St. Louis metro area. You've got groups like ours that have a much broader reach. I'd say that's probably a little less common. And, you know, there are things that come up, you know, I'll say particularly with respect to Spanish, that, you know, our partners at NIH don't always understand that, you know, there are different forms of Spanish spoken in different regions. And that has to do with where people come from. It has to do with, you know, the San Luis Valley, for example, you know, has a long history of that goes back before the founding of, you know, before there was immigration from Northern Europe. There was, you know, Spanish folks that came to that part of our state. And so the Spanish is fairly distinct and unique there. And that's something that we've had to sort of educate our funders on when they're talking about, well, we'd love to provide resources, you know, in Spanish. We're like, okay, that's great. We appreciate that, but we want to make sure it's Spanish that's going to be understandable and also culturally relevant to our local populations. You know, on the far end of the spectrum, though, you've got, you know, like the California SEAL team. And not only are they trying to work with different regions, but there's also like 3 or 4 different academic institutions that are part of that team. And that just makes my head explode. I can't imagine that. You know, but they're hanging in there and they're continuing to do important and good work. And so that's been really interesting. The other distinct culture that we've grown a lot in our understanding of and our ability to serve through our SEAL work is the Somali immigrant community in the Morgan and Weld County region. Oh my gosh. So much really deep learning, I'll say on my part, in terms of working with a community like that that's very distinct, very rich, and has so many great things to share for us in terms of lessons to how to do this work.
Thank you, Dawn. All right. I don't see any other questions in the chat. So I guess we got about 7 minutes. I feel like, oh, we have one. Jonathan asked, any advice on how to best go about initially engaging communities to gauge interest in a specific topic? Anyone want to take this one?
So I would always say start with a trusted messenger, a trusted community member. That is going to be the key. And, figure out who you want to participate, whose opinion, whose feedback, who you want to engage. So that's really going to be the deciding factor as to, how you're going to recruit them, where they're going to be located. I'll give you a quick example. I have been to meetings where they have, interpretation. They went ahead and promoted the event, say like on a website, and they shared it within their professional networks, but the community didn't show up. That is not a part of that field already because they didn't go to the carnicerias, they didn't go to the laundromats, they didn't go to the local coffee shops. They didn't use the out of the box methods of reaching individuals that you want present. So if you only send an email to your professional network, you're not really going to get a well-rounded audience. So it's finding those individuals, say for example, if you were to reach out to someone that already works, with refugees, with promotoras that already work with mixed status families. So it just depends on who you're trying to bring on and knowing who to go to reach that audience. But most importantly, I would say is being well-rounded in who you bring in, making sure that if you want individuals from a neglected neighborhood, individuals who are impacted by the issue or issues that you want to discuss, don't be afraid to ask. Does anyone have any issues with transportation? Because sometimes individuals don't show up because they couldn't find daycare or they can't afford daycare. So if you say, this is a family-friendly space, we will provide activities for children, feel free to bring your entire family, we want to hear from you, you are going to have families there. But if we're not explicit about this is a family-friendly event, it's only going to bring in those individuals that either have that support system or possibly are only in that professional field, which is not usually, the type of audience that you want when you're trying to get, everyone's perspective and opinion and see how different people feel. But I would say always go to those who are impacted first, because they know and they understand more than anyone else, and make sure that you are providing resources if any barriers show up and that you offer them, because they're not going to ask. So, there was a time where I was engaging community members and a gentleman first started off at the very beginning of the meeting. He raised his hand. He goes, "Can I go first? I have to get off because I have a prepaid phone. So I cannot be on here the entire time." So guess what? I talked to the organization that I was working for at the time, and I said, do we have, an extra laptop? Do we have an extra, device that we can allow this person to utilize for the extent of the project so that they can participate? And guess what? We gave them an iPad, I think it was, that had internet and all of that. So he was able to participate. So it's once you see that those barriers are there, take care of them, bring that feedback back to your organization and say, this is why they're not coming. They don't have transportation.
Thank you. Yeah, thank you so for that. I wanted to give some time for Javier to chime in really quick. Javier, go ahead.
Yeah, Chelsea, I was just going to say that through community immersion training, I've learned that when trying to engage a specific community into a specific topic, sometimes the approach will be a little different. And so I think I would go back into those communities and ask what it is that you guys not necessarily need, but what's of interest. And you might, even as a researcher, might be surprised that something that was very specific that you wanted to work around might not be what community needs. So you might have to change your focus, and it's okay if you can do that. That would be amazing for a community.
Amazing. Awesome. Well, I think do we have time for another question? Let's see. The last question was, maybe we can give some time to Lisa really quick to answer this last question, which is from Sarah. I'm really curious about how you all think about which capacities you want to build. For example, how do you think ahead into which skills you hope to build, not just being reactive to project needs, but building projects that build the capacities you and your communities want to grow? And you got like a minute, fire off.
So I think it kind of goes back to what Javier just stated. It's not so it's the community will let me know what capacities need to be built. I just have to be open to receiving what they're saying, I guess. And to, you know, as I do any community engagement, you know, I can, you know, typically see kind of what the needs are, but most of the times in my community, at least with the relationships I have, people will say what we know what their needs are and what needs to be built. That was 30 seconds.
Thank you, Lisa. Thank you all panelists so much. This was an excellent conversation. And yeah, I will go ahead and hand it over to Sarah to close out this forum.
Thank you all. I learned so much from all of your experiences and the stories that you shared, and I really appreciate you giving everyone these examples of what it looks like to do capacity building within a very large research project and in multiple communities across Colorado. So thank you all for agreeing to be here and sharing. I do want to let all of you know who are here. The recording will be shared later today, at least on the Accords website. I'm not sure the timeline for it being up on CCTSI's, but it'll be up shortly. And feel free to share this with your colleagues. I think from my perspective, this was a conversation that helped me a lot, and I will most definitely be sharing with colleagues who are doing capacity building in their work as well. If you haven't seen it yet, Jordan posted our evaluation link in the chat, and we hope you'll give us a little bit of feedback and tell us what other topics you hope we can cover in future community engagement forums. And then lastly, I want to put it out there once more that our next community engagement forum will be on April 26th, and we will be in person at the Health Sciences Building on the Anschutz campus from 11 to 1. And we are hoping that this is an opportunity for people to meet each other, find new community partners or researcher partners. And we'll be sending out more details over the next month or so, but please put that on your calendars. We hope to see you all there. Thank you all so much for being here today.